Hi, welcome everyone to our Cecilia Health webinar. Today we will be discussing a healthy heart is a happy heart. I'm Emily, I'm one of the dietitians here at Cecilia Health, and thank you all for joining us today. You will see a number at the bottom of your screen. It's 1-800-263-6317. If you're having any difficulties, please do contact that number. But thanks again for joining us. Next slide, please, here, Marcia. There we go. So today it is meant to be an interactive program. So the idea is that Marcia, also a dietitian, diabetes educator, will be doing a short presentation today. And at the end, we will have time for some discussion, question and answer time. So in your toolbar off to the right, you will see a questions tab. You can enter in your question there at any point during the webinar today, and she will answer here at the end of our time. And as a disclaimer, we know that the information that you are about to hear may motivate you to make some changes, but please do talk to your doctor before making any changes to your current routine. The the Cecilia Health Certified Diabetes Educators will provide strategies to help you manage your diabetes and your health, but this online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the diabetes educator. So today, like I said, our presenter is Marcia Carlson. She is a dietitian and a diabetes educator for more than 25 years. She lives in Southwest Wisconsin near her parents, daughter, and her family, and she loves the outdoors and enjoys biking, running, and hiking when she's not playing with her grandkids. So thank you all again for joining us today, and I'm going to hand it over to Marcia. Thank you.
Hello, good afternoon. Today we're going to talk a little bit about heart disease. Our discussion will include what is cardiovascular disease, risk factors, why are people with diabetes at increased risks, steps you can take to prevent cardiovascular disease. And again, we'll share resources and feel free to jot down questions and enter them in the chat box. So first of all, what is cardiovascular disease? Heart disease. Related to atherosclerosis, it's a mouthful, plaque can build up in the artery walls, as you can see through this diagram on the right there. That narrows your arteries and it makes it harder for blood to pass through. This can form a blood clot, which may break off or form and stop blood flow to your heart or your brain, causing a heart attack or a stroke. Some warning signs of cardiovascular disease or heart disease: discomfort in the center of your chest that can last a few minutes or can go away and come back. Discomfort in other areas of your upper body, your arm, your back, your neck, your jaw, your stomach. Shortness of breath, breaking into a cold sweat or nausea. Some of these symptoms may be confused with muscle strain or epigastric pain, but just making sure that if you do have these symptoms, recognize that they may be signs of a heart attack. Signs of a stroke, another related cardiovascular complication. Sudden numbness, weakness, confusion, difficulty speaking or understanding, sudden trouble seeing or walking, dizziness, loss of balance, lack of coordination. Also, a severe sudden headache with an unknown cause. Notice these are sudden symptoms. A good acronym to keep in mind is FAST. F, face. If you're with someone who you think may be having a stroke, ask them to smile. Does one side of their face droop? Ask them to raise both their arms. Does an arm drift downward? Ask them to talk, repeating a simple phrase. And if you observe any of those signs, call 911 immediately. The best remedy for a stroke is early treatment, we found. So that's very important. So keep that handy, that acronym. Other types of cardiovascular disease. Heart failure, when your heart isn't pumping blood as well as it should. There's more blood oxygen for blood and oxygen is not met, and so you would feel tired, unable to exert yourself. Arrhythmia, abnormal rhythm of the heart affects the efficiency of the heart, and a heart valve problem where valves don't open or close properly. Causes of heart disease, aging. As we all age, which is a good thing to have, our hearts do become weaker as we get older. May be affected by genetics. Direct family members have heart disease at a higher risk. Lifestyle does have a big impact on your risk factor. Work stress, lack of exercise can increase risk of heart disease. Men, fortunately, can control that, but you're 3 to 5 times more likely to develop heart disease. Smoking, increase the heart rate, lower oxygen level in heart muscles, and can cause clots or thrombosis. Diabetes, which is our topic here, high blood pressure, hypertension, and higher blood glucose can lead to angiosclerosis and damage the inside of the blood vessels. A diet, we found, does have an impact on your risk of heart disease. Foods that are higher in fat, salt, sugar, as well as foods containing alcohol, increase the risk of heart disease and can cause high blood pressure. So we'll talk more about that in our current slides. Diabetes and cardiovascular disease. 68%, so way over half of people aged 65 or older with diabetes will die from some form of heart disease, and 16% will die of stroke. So it is a more common side effect relating to diabetes. Adults are 4 more times likely to have heart disease or stroke if they have diabetes. The American Heart Association considers diabetes the 7 major controllable risk factors for cardiovascular disease. So if you do have a diagnosis of diabetes, it is a significant concern for you to be aware of your cardiovascular risk. Why is this so? People with diabetes tend to have higher blood pressure. They may have abnormal cholesterol or high triglyceride levels. And if you don't know these numbers, make sure you ask your doctor. It's recommended to have them checked by your doctor, and they can talk to you about how those levels will impact your risk. Being overweight can also be associated with insulin resistance or inability to use the insulin appropriately. Sedentary, lack of physical activity, and an increase in inflammation, and that might be a result of having diabetes can increase those inflammation markers in your blood. So ask your doctor if you have questions about that. So what can you do? Well, you lower your blood pressure. Many people with diabetes are also monitoring their blood pressure. They may be taking medications for their blood pressure. Just make sure you check with your doctor about the right numbers for you and the goal they would like you to attain. Lose weight if possible. Exercise more. Manage your diabetes and quit smoking. Those are the big things you can do to help lower your risk of cardiovascular disease and other complications of diabetes. We'll talk about that. So blood pressure. Blood pressure does increase your risk of stroke. Blood pressure less than 130/80 is recommended for people with diabetes, but again, check with your doctor. Limiting your salt or the sodium in your diet can make a big difference in your blood pressure and helps your medications also work more efficiently. It's recommended 1,500 milligrams per day, which is about a half a teaspoon, so it's not much. And some people may gradually work towards that level, as most Americans eat quite a bit more than that in our regular day. If you do have questions, ask your health coach or your doctor. Want to get 4 to 5 cups of fruits and vegetables daily and 30 minutes of moderate or vigorous exercise at least 5 days of the week, about 150 minutes per week. And that is a recommendation for most almost Americans as well. Quit smoking and take your medication. Many people feel they're taking a lot of medications Sometimes takes several medications to manage blood pressure effectively, but that's very important. So take your medications as directed. Obesity, being overweight, and complications that can be linked to it can raise your odds of having a stroke. But the good news is you don't have to lose a lot of weight. Just a moderate amount of weight, up to 10 pounds, can make a big difference in your risks and increase your overall health. Talk to your doctor, your dietitian to achieve your weight loss goals. Eatright.org is a really good resource there for you to get started. And increase your activity, your physical activity. Make it part of your day, part of your routine to just move more, and it does have a big impact. If you check your blood sugars, for a chronically high blood sugar can damage the blood vessels over time and can make a blood clot more likely to form. Make sure that you are monitoring your blood sugar as directed, and you know the goals that you are aiming for with your blood sugar management and your control. Using diet, exercise, and medications keep your blood pressure within the recommended range most of the time. It's not going to be perfect. It's never going to be 100%, but if it's within the range, the majority of the time, you're really reducing your risk. So keeping up on your lab values, checking in with your doctor and your dietitian and your educators on your health coach about what you can do to keep those numbers in a safe, healthy range. Smoking. Smoking, in addition to contributing to other health problems, does contribute to heart disease. It accelerates clot formation. Most people who have smoked do take many tries to achieve tobacco cessation or quitting smoking. But just remember that if it doesn't work the first time, just keep trying, and each attempt will bring you closer to successfully beating the habit. There are many helplines that are available. There are many resources through your clinic. So be sure you reach out to those for any aids that you might need, or your doctor for referrals. There's lots of resources out there to help you. So these are some of the resources that we have. American Heart Association has a lot of information. They have recipes, they have exercise, they have medication, just a lot of good, well-researched information for you to get started, as well as the National Heart, Lung, and Blood Institute. They have a lot of information on how to get started with physical activity, as well as the CDC. The American Diabetes Association has very good resources on a spot on their website, Diabetes Food Hub, which has a lot of information on recipes, meal planning, if you need some help getting started or want to learn a little bit more about that. And then nutrition.gov is a great source looking for, especially for food labels and purchasing items for resources on grocery shopping, meal planning, cooking, things like that. So keep these jotted down, and if you have a chance, look through those to see if there's some help or information that you can glean, because the more you know and the more types of strategies you try, the more successful you'll be to find something that really fits for you. So that's part of working with your health coach and your doctor, finding things that make you successful so you can meet your goals and stay healthy. So that's the presentation I have. I wanted to know if there were any questions anybody has. Okay. Well, something that came up is cutting down on salt or sodium, and what's the best way to cut down, because that my doctors asked me to do that, and I have trouble because I like salty foods. And as I said, most Americans are very used to eating higher amounts of sodium in our foods than is recommended. One thing to do is to avoid foods that are overly processed, like canned soups, frozen dinners, fast foods, things like sausages, bacon, those kind of foods have a lot of sodium added in the processing. If we choose more whole foods like the fruits and vegetables, or start with uncooked meat versus cured meats, that cuts down on the sodium quite a bit. Reading labels on those types of foods for the amount of sodium, again, keeping in mind that 1500 might be a goal. You might want to aim to work towards that over a period of time. So cutting back little by little, and then just taking the salt shaker off the table. Getting out of that habit, using different things in cooking and seasoning, like Mrs. Dash products, lemon. You can look for other herb type replacements for that sodium, but it does take a while to adjust, but you will get used to things and enjoy the natural taste of foods without the sodium after a while. Getting started on an exercise plan, always a challenge for people. So what are some things I can do if I have limited mobility? I always encourage people, if they have challenges with movement, to see a physical therapist, even for a couple sessions, to get some really good foundation exercises. Things that you can do in your home that don't stress your joints, could be like a Sit and Be Fit video. There's Silver Sneakers has home exercises, or even just doing some simple chair exercises, while you're watching TV, just to get moving, get your muscles stronger, and then working up from there. I think people think exercise needs to be an hour in the gym, but just really starting out slow, working up so that you don't get burnt out, you don't get sore, you don't get hurt, and work with your doctor for an appropriate plan. So, how about balancing? Can I eat fruit if I have diabetes? I heard fruit has a lot of sugar. Ah, that's a very good question that we do get a lot, because fruits have carbohydrate, which does translate into blood sugar. So if you eat too much fruit at one time, you may get a blood sugar that's not in a healthy range. But I generally give people with diabetes a guideline of eating a whole fruit that's higher in fiber, something like an apple or an orange or berries or cantaloupe, in a moderate portion, which is maybe a half a cup to a cup of cut up. A couple times a day is not going to aggravate your blood sugar. It gives you that natural sweetness. It gives you fiber and nutrients that aren't in other foods, and certainly, can satisfy some of the sweet cravings, and can be included in your meals. I discourage juice. In general, you do want to choose higher fiber options that won't make your blood sugar raise quite as high. So there are, yep.
Wonderful. Well, thank you so much again, Marcia, for going through all that information pertaining to the heart. Kind of like how Marcia was answering questions more related to food here at the end today. We do have a couple other webinars that we do go more into detail with diabetes, but also with CKD as well, if you're looking for more information regarding the salt. So you can check those out as well on our website with Cecilia Health. Here on our next slide, please, Marcia, you will see we have two webinars here coming up here this year. One is just a Diabetes 101, really cover a lot of basic information. If you're looking for something more specific, though, check out our website and you can find that. And then in November is holiday eating. We usually do that time of year because that's what people want to learn more about as well. As always, you can check out our Facebook page. You can check out Cecilia Health's website. You can also, please do talk to your health coach as well. If there's something that you have questions about, please check that out. But again, thank you all for joining us today and have a great rest of your day. Bye-bye.